Welcome everyone to Caregiver Solutions. I am Dana Cameron, Client Services Manager here at Vantage Aging. We are joined today by Marie Hooper, Director of Altman Breast Surgery and Cancer Navigation. Marie has been at Altman since September 1993. Marie has worked her whole career in the cancer program where she started on the inpatient oncology unit as a staff nurse. She became the unit director of that unit in 2003 and stayed in that position until mid-2019. Marie then became the director of cancer navigation, community outreach, and Altman breast surgery in 2020. Altman has had a cancer navigation program for about 15 years. It started with just one site and has continued to grow over the years. Welcome, Marie.
Thank you. It's nice to be here. So today I was asked to explain a little bit about our cancer navigation program. So I just wanted to go through all of the different disciplines that we have in our navigation program and give you guys some information about that. I don't know if anybody knows or not, but we did build a new cancer center here at Altman Hospital, and we moved into that in September of 2022. So I thought it'd be nice to show a picture of our new building. And it has been a fantastic space for patients and the providers that work here. So we waited for it. I was here waiting for it for about 20 years before we got it. So it's very nice. Okay, next slide, please. Okay, so some of the things that we offer here at Altman as part of our cancer services is we have a full range of services. We have diagnostics, surgery, we have hematology and oncology offices. We also have gynecology, oncology offices. The center, infusion center here gives chemotherapy, immunotherapy, and a range of other treatments. We have a radiation oncology department, clinical trials, navigation, social worker, survivor care, and dietitian. And those last four things are what I really want to talk to you about today. So next slide, please. I just wanted to let everybody know that we do, our cancer program is accredited. So NAPBC is our accreditation for our breast center. So it's the breast care center, but it also is the whole breast program that we have here at Altman. We have radiation, or radiologists, that work in the breast care center that specialize in reading of mammograms, ultrasounds, and then they also perform any of the biopsies that are done. And we also have two fellowship trained breast surgeons that work for the hospital. We are accredited by the Commission on Cancer, and we have been accredited by the Commission on Cancer since the 80s, but recently we just changed into an integrated network cancer program. And basically what that means is that our other facilities, so Altman Alliance and Altman Main Hospital in Canton here, are joined together to be accredited at the same time. So we are standardizing all of our processes between the two facilities and making sure that we're doing everything according to the Commission on Cancer standards. And then the radiology, they have ACR accreditation for the radiology breast imaging center too. Next slide, please. So the Timken Family Cancer Center, we have infusion services, and that infusion services has 44 treatment areas, and we have a dedicated lab and a dedicated pharmacy for that area, and that's quite a different thing. The infusion chairs in there, the patients get a nice view of the outside because they have a window in their room, and it's been a really nice change for them. We have our radiation oncology department got completely updated, and also, with the technology got all updated and the environment all got updated as well. So it's very nice in there. We have a multi-specialty oncology clinic, and upstairs here at the Cancer Center, we have medical oncology, GYN oncology, palliative care, and then there's multidisciplinary clinic space as well. And then we have our supportive care services, and that's patient navigation, the dietitian, and the social worker. Next slide, please. So a lot of people don't really understand the role of the navigator, so I thought I would explain that a little bit. Cancer navigators tend to find out about the patients. They receive path reports every day. So a path report is somebody who has a positive cancer diagnosis that's new, and that kind of puts people on their radar. So they start to interact with patients usually at that starting point of diagnosis. And that could be, they could, get that information from the path report, or sometimes they get a referral from a provider, a nurse, a social worker. Anybody can refer to navigation. Sometimes the patients refer themselves. So navigators, they provide education to the patient and their families about diagnosis and treatment. They inform the patient about what to expect prior to, during, and after treatment. We try to identify and address any barriers to timely diagnosis and treatment. So if a patient has been referred to, get testing, and maybe that testing is, too far out, we try to get that time decreased and get them in sooner. So that's one of the things. We also assist in making referrals and appointments. Any kind of support services that are needed, navigators recognize that and facilitate that, making sure that those referrals are placed. They provide emotional support for patients and their loved ones. We have something called tumor board, and tumor board meets depending on the site. Breast tumor board meets every week. We have a lung tumor board, a general, a GYN. And tumor board is an interdisciplinary conference where members the physicians from pathology, radiology, surgery, the hematology oncology office, all of those doctors get together. Navigators participate in that. They discuss the case and decide on the best course of treatment for the patient. And that's usually done prior to the start of treatment. A lot of times the navigators help pick the cases that are going to be presented, and it might be people that are, a little bit more complex. And we just want to make sure that we are giving the best care possible, and that's what the tumor board helps to identify. We also participate in a lot of community events and try to really promote screening and prevention. So navigators kind of do a lot, and they're there for their patients. They're meeting with them during treatments, and also they have phone calls with them. Patients can reach out at any point in time to get their navigator if they've got questions or concerns. Next slide, please. So we have 4 designated navigators. We have a breast navigator, GYN head and neck, GU, GYN. So GU would be like prostate, bladder, kidneys, and then GYN, so like ovarian, uterine, anything to do with your female parts, any cancers there. And we also have a lung. But that's not what we're limited to. So if somebody needs a navigator for any other cancer type, whether it's lymphoma, leukemia, melanoma, you name it, if they need it, all we have to do is get a phone call or an order placed for them, and we will make sure that they get a navigator that can help them throughout their diagnosis and treatment. So one big part of navigation is survivorship. Your cancer, it's a usually long process to getting through the cancer treatment. And at the end of that, what we do is we provide a survivorship care plan to a patient. So that care plan has a summary of all the treatment and everything that was received throughout their diagnosis, and all of the follow-up recommendations. Because sometimes people are at a loss of like, okay, I'm done with treatment. What happens now? And that's not really, something that is a problem for the oncologist. However, primary care providers need to know like what to do, what to follow up with. So those survivorship care plans are put together. The oncologist has to approve those. And then what happens is patients have appointments with an advanced practice nurse or with our survivorship coordinator to review that survivorship care plan. That care plan gets put in the medical record, but then a copy is also given to the patient and the primary care provider so that everybody can be on the same page, so that the patient continues to get the right treatment moving forward. And that follow-up care is really important. Next slide. So part of survivorship is we have a moving forward program. We try to provide as much support for patients as we can as they're going through their treatment. Moving forward is run by our survivorship coordinator. It's held twice a month here at the cancer center. It's open to any current or former cancer patients who've received treatment here at Altman. And this is a really great program. I can't speak enough about this. We have breakout sessions there that offer Reiki and massage to patients, and all this is free of charge. There's also a support group, and that support group, it's led by one of our behavioral health people here from Altman. But we also have other breakout sessions that, give people an opportunity to meet with some of our interdisciplinary folks that maybe they don't know about, and haven't had a chance to. So sometimes we have guests from physical therapy, pelvic floor therapy, the dietitians come. So it's all about making sure that the patients get whatever information that they need and the support that they need. And then the Reiki massage is just a nice little treat so that people can relax a little bit. Next slide. I can't speak highly enough about our social worker. Rachel, we have one full-time social worker, and she does a phenomenal job. She provides, obviously, emotional support for patients and families, but one of her biggest roles is trying to help with financial concerns. Obviously, a cancer diagnosis can take its toll on people financially. And so we refer a lot to community resources out there, and it's a big deal. She helps get people grants to help pay for their mortgage or pay their bills that if they can't afford them. We also, she can help set up things like compassion delivered meals on wheels, home health things that might need done. Transportation is a big deal for people, and so she helps set up transportation. We do something called a psychosocial distress screening, and that's usually done at that first pivotal visit that a patient has here in the program, and that helps us identify any needs that they might have, any barriers that might prevent them from getting the care that they need. And so Rachel helps track those things, and then we're able to identify the needs of the patients. We also have something here called a Cancer Care Fund. It's through generous support of employees and the community that we have this Cancer Care Fund. And the Cancer Care Fund, we use that to purchase gift cards, and those gift cards we get for gas, groceries for like Walmart, Giant Eagle, those things. And anybody in active treatment is eligible to get $100 worth of gift cards once a month if they need them. And we give a maximum of $500 a year, but Rachel helps facilitate making sure that those gift cards get distributed and tracked appropriately. We've also been fortunate enough to get some grants from the American Cancer Society in the last few years for transportation. And with that, we've been buying gas cards, which obviously has been huge over the last few years when gas prices really went up. And that helps get people here to get treatment. Now, we can't pay for things like, mortgage and bill, utility bills and things like that out of the Cancer Care Fund. But what we'd like to do is we figure that giving the gift cards will help kind of offset some of the cost. And so if we're helping them get groceries, maybe then they can, pay for the bills. Or like if you're able to transfer your prescriptions to one of the places where we have the gift cards to, that can help pay for your prescriptions that you need. Rachel also has a support group because cancer doesn't just take its toll on patients, it takes its toll on the family members as well. So she leads a caregiver support group. Next slide, please. So this is just some information about her caregiver support group. She has this once a month, but it's a couple of times. So she has a day session and an evening session. So whatever works out best for the people who want to come. And it's just about providing emotional support for anybody who's caring for, helping care for a loved one with cancer. Next slide, please. Now, this one is phenomenal because we just started a dietitian program here. It was in 2021. And before that, we had to rely on dietitians coming just to like our moving forward group and stuff for patient to have access to them. Unfortunately, a lot of healthcare insurances do not cover outpatient dietitian services. Fortunate for us, we were able to get grants and get this program started, and it was so much needed and so popular with the patients, and the providers were thrilled with it that we were able to then add a second dietitian to the program. And all of this again is free of charge to the patient. So dietitians, cancer care treatment obviously takes its toll on people, and some cancers are worse than others as far as like nutritional status goes. And our dietitians, they provide nutritional care through screening and assessment. They do all kinds of interventions to help improve health. They provide nutrition care for cancer prevention, treatment, and survivorship. They also try to make sure that patients can understand those concepts and implement them to optimize their health. They teach practical ways to get good nutrition through grocery shopping and meal preparation, and then they identify and facilitate resources to obtain alternative nutritional needs. There's a lot of things out there in the community that can help patients get meals that they need. And there are patients here that obviously need some additional nutritional support, and we are fortunate enough to have a good resource through our dietitians, and we get a lot of free Boost and Ensure products that we can provide to patients free of charge as well. So to help them nutritionally. Next slide, please. So I just wanted to talk about like how important it is for us to actually interact with resources out in the community. It's a big deal for us. We like to know what's out there and make those connections between the patients and these resources. So some of the things I already talked about, the Cancer Care Fund. We also have a breast care fund. Again, that's support for that. The funds for that come from the community. A lot of that is from, we did a Paddle for Pink event in September. And, those funds go to the breast care fund. The breast care fund, unfortunately, breast cancer is our largest cancer diagnosed here at the hospital every year. So we have this special fund for it. It helps us provide screening for patients, but it also helps us provide things like lymphedema supplies, also the gas and grocery cards. We also have a North Kent Medical Foundation Cancer Relief Fund. This fund is good because they actually, with an application that the Navigators will help fill out, or the social worker will help fill out, this fund could potentially provide help, with mortgage and utility bills, things that we can't do with our Cancer Care Fund. We use Compassion Delivered a lot, Aunt Susie's, obviously the American Cancer Society, and there's Little Pink Ribbon Girl, and many, many others that are out there in the community. Okay, next slide. Another big thing that we do is we like to get ourselves out there and make sure that the community knows about the appropriate screening that everybody of all age groups needs to do, and hopefully some prevention information as well, because our goal is to make sure that to keep people from getting cancer, but then also if they do get it, that we're catching it early. And that's the important way to do that is through screening. We also like to educate about healthy lifestyle choices, and then we provide free screening opportunities to the underserved. So next slide, please. These are just a few of the things that we have. I don't know if anybody knows this or not, but November is Lung Cancer Awareness Month. So we actually just had a lung cancer awareness event here at the hospital and in the cancer center. And with that, we were able to provide information about smoking cessation, but then also there are specific screenings just for lung cancer. So that is low dose CAT scans that are used specifically for lung cancer screening. So I just wanted to show you that, we do have handouts available that list the different screenings and age appropriate, so that people know what to get and when to get them. If you're interested in these, I can make sure that you get a copy that can be can be given out. The next slide, please. We just had in October, obviously October is Breast Cancer Awareness Month. Everybody's usually aware of that. Women are pretty vocal about the top cancer that affects them. So every October we have a free screening event, and we try to get people signed up for this, and we provide the screening and any additional screening that, like if you have a mammogram and then that mammogram means you need then an ultrasound or something else after, all of that is included in the free screening. And we do this every year in October. So next slide, please. And then I just put us some pictures of us out at the different events, so that you could see that, you know, we do partner with area organizations and try to get ourselves out there and spread the awareness. So next slide. And that's all I have. Does anybody have any questions about anything?
I have a question. I was wondering, sometimes when I do intake for Meals on Wheels, I will talk to a client who is receiving care for cancer, and sometimes they're at an office and they're not sure what hospital their doctor is associated with, because I've asked them if they've worked with a cancer navigator, and for some patients, they're not familiar with it. Do they just ask their physician, or if they're have you found that oncologists work with a couple different hospitals? That's been the hardest thing for me to kind of guide them the best way.
Yeah, so here at Altman, we actually have physicians that are employed, but we also have other oncologists that are not employed but have privileges here.
Mm-hmm.
So our navigation team only sees patients who are getting their treatment here. So we don't see patients who are, you know, getting treatment elsewhere. It would be kind of hard to do that. But if the patient wants a navigator or is uncertain if navigation is available, all they have to do, their oncologist should be aware. So if they just ask the oncologist should know that navigation is yes available or not, depending on where they're at. And then if they do have it, honestly, it's a simple click of a button in our electronic medical record to place an order, or just a quick phone call and to get us involved.
Okay, that's good to know. Thank you.
Mm-hmm.
And I was amazed to see all the things that your team does. I am a social worker, so I really appreciate the social work side, but also including the help, you know, the dietary side and all of those different ways to navigate, especially the I guess the financial kind of concerns that people have too.
Yeah, cancer really, you know, I mean, it's a burden, you know, and it kind of takes over your entire life, but not just, you know, not just the person going through it, but also their family. And, you know, it causes a lot of financial stress. And, you know, our goal is to hopefully make that a little bit lighter because, you know, insurance is great, but, you know, there are additional costs and it doesn't cover everything. And so we like to do our part to try to help as much as we possibly can.
Yeah, it's wonderful. And it's wonderful that you have a new, beautiful building also. And I loved that people have the view of outside now to receive their treatment. I'm sure, I know for me, that would make a difference just having sunlight. So that's nice that they have that too.
Yeah, that's huge. We have a lot of nice outdoor space too, if you know, if people want to go outside. So yeah, a lot of thought was put into the building, and just so that you're aware, you know, in all of the planning, there was actually a patient group that provided input. So the patient group provided input on color schemes, furniture, artwork, everything. They were involved all the way through the process. So it was kind of nice.
I love that. I don't know how often, being a former healthcare worker myself, I always think like they should really take into consideration the healthcare worker and the patient, you know, feedback on what would be good for them. So that's wonderful.
Yeah, I mean, it's easy for us as healthcare workers, you know, we're here and we think we know what's best. We don't, because, you know, not all the time, we're not sitting there going through the treatment. So,
True.
you know, it's the things that they want, you know, our chairs in our infusion department have heat and massage. That's because they wanted that, you know. I mean,
Yeah.
everything that we can do, you know, and I forgot to mention, just because that just made me think, we actually started providing music therapy and art therapy here during infusion treatments. And it's just to
Wow.
help try to get people's mind off of what they're going through. And, it's a distraction and passes the time while you're sitting, through a long cancer treatment. So we do have a really great music therapist. She comes in once or twice a week, and the art therapist also comes in twice a week. So.
Wow. I love that you have that. That's like the extra step. Medical model, of course, is needed, but those extra things that also contribute to someone's well-being.
Yeah.
That's wonderful. Thank you, Marie, for sharing. I'm so thankful that you came to talk about these services. I know personally through a family member how valuable it can be. So I really appreciate all the work that you and your team do.
Yeah, if anybody has any questions, down the line, if you just reach out to me, I'd be happy to help you with anything that you need, okay?
Okay. Thank you so much.
All right, thank you.
All right. Have a good afternoon, everybody.